Several years ago, Steve came to see me because he was having trouble regulating his blood sugar levels. He's not alone. He is in the same boat as 34.2 million Americans who have a diabetes diagnosis. And there are 88 million more Americans who are pre-diabetic. They don't have diabetes yet, but they're well on their way towards that point. And it was especially challenging because he was on medication that he didn't really want to take, and it was beginning to impact the rest of his life. After just a few short weeks of working with us, he figured out how his diet was impacting his blood sugar. He followed our recommendations and he watched his blood sugar levels return to normal, and then he was able to work with his physician to eliminate his medication. By the time we were done working together, he felt better physically and mentally than he had done in years. Hi, my name is Jane Reynolds and I'm a board-certified holistic nutritionist, and I help people understand the influence that diet and lifestyle have on their health. And then I get to help them make better choices every single day so that, just like Steve, they can feel better physically and mentally than they have done in years. So what is diabetes? Well, diabetes is a disease in which your blood sugar levels are abnormally high. You officially have diabetes when your fasting overnight blood sugar levels are over 126 milligrams per deciliter. Doctors can also do a glucose challenge test in which they give you 75 grams of glucose to drink and then check your blood sugar 2 hours later. If that number is over 200 milligrams per deciliter at that point, then they classify it as diabetes. Finally, if you take a random blood glucose test at any point during the day and it is at or over 200 milligrams per deciliter, and you have accompanying symptoms such as increased urination, thirst, hunger, fatigue, blurred vision, poor wound healing, periodontal disease, and frequent infections, then you can also be classified as having diabetes. We also know that diabetes greatly increases the risk of heart disease, of stroke and kidney disease, loss of nerve function, hypertension, blindness, amputations, pain, depression, and autoimmune disorders. And we've seen in the last year that it leaves you wide open and susceptible to the ravages of COVID-19. So what causes diabetes? Well, the truth is there are as many as 5 or 6 different types of diabetes, and each one has its own root cause. So let's take a moment and look at them individually. The first one is type 1. That occurs most often in children, and so it's called juvenile or insulin-dependent diabetes, and it makes up 5 to 10% of all cases. Most of these cases are actually caused by an autoimmune condition. The theory is that a genetically predisposed individual suffers some sort of viral illness that provokes an attack by the immune system. The antibodies that are generated don't end up attacking the virus or the infection. What they actually end up doing is attacking the pancreas and destroying the body's ability to secrete insulin. Type 2 is the most common type of diabetes, and it accounts for 90 to 95% of the cases, but its causes are not really very well understood. Although the pancreas continues to produce insulin and secrete it, the cells inside the body no longer respond to it normally. That process is called insulin insensitivity. Insulin insensitivity is thought to happen over time and possibly begins with impaired glucose tolerance, which means the body can't process sugar like it used to. So after a meal containing sugar, the levels of blood sugar stay very high, and they stay high for an abnormally long period of time. After a while, people begin to experience impaired fasting glucose, meaning that their blood sugar is high even though they haven't really eaten recently. The third one listed here is type 1.5. This is latent autoimmune diabetes in adults. This type is really juvenile or type 1 diabetes that occurs later in life. The autoimmune process that shuts down the production of insulin from the pancreas occurs very slowly rather than rapidly like it does in type 1. It's often actually misdiagnosed as type 2 simply because it occurs to adults over the age of 35. Now, you might have heard mention of type 3 diabetes in recent years, especially with regards to Alzheimer's disease. This type 3 diabetes is a term that has been proposed to describe the hypothesis that Alzheimer's disease, which is a major cause of dementia, is triggered by a type of insulin resistance and insulin-like growth factor dysfunction that occurs specifically inside the brain. This condition has also been used by some to describe people who have type 2 diabetes and are also diagnosed with Alzheimer's disease dementia. The classification of type 3 diabetes is actually highly controversial. It's not really widely accepted by the medical community as a clinical diagnosis, but you may hear it mentioned. The last two types here are gestational diabetes and idiopathic diabetes. Gestational occurs during pregnancy, and idiopathic means that they can't think of any other reason why it would be caused. So it occurs when the pancreas doesn't produce insulin as well as it should, but it's not related, as far as they can tell, to any type of autoimmune disease. It just stops functioning properly. And that means that they also need additional insulin to help them manage the disease process. There are several different types of tests that a diabetic should take on a regular basis to keep an eye on their well-being. The first is one that you are probably most familiar with, and you'll see a diabetic checking their blood sugar with either a finger prick test that they squeeze a droplet of blood onto their card that goes inside a monitor and tells them what their blood sugar is. There are other more technologically advanced tests now for doing that. I've got a friend who's diabetic, and she has a patch that's on her arm, and her cell phone is able to read the monitor and tell her where her blood sugar is currently at. It saved her finger from all those finger pokes. And then I have a family member who is a type 1 diabetic, and he has an insulin pump, and that constantly monitors where his blood sugar levels are at and sends an alarm to his phone if his blood sugars are getting too high or too low. Now, there are two different sets of ranges. For a normal range, for a non-diabetic, upon waking and just before each meal, their reading should be 120 milligrams per deciliter or less, and then 2 hours after each meal that should be less than 140 milligrams, and also at bedtime 140 milligrams or less per deciliter. For a diabetic, those ranges are slightly different. Upon waking and just before each meal, it should be somewhere between 80 and 130 milligrams per deciliter. 2 hours after a meal, it should be expected to be less than 180 milligrams per deciliter, and at bedtime 100 to 140 milligrams per deciliter. Hemoglobin A1C is a test that measures the level of blood glucose over the last 3 months. Sorry about that. It measures how additional sugar molecules are sticking to the hemoglobin. An A1C of over 6.5% is considered diabetic. And then another thing they should get checked out is their lipid panels. Diabetes and heart disease tend to go hand in hand. They are so closely related that anyone with insulin insensitivity or diabetes should have a routine test to check their triglyceride levels and their cholesterol levels. I think it's a test that no matter what state of health you're in, you should be having done at least annually. That test will also measure the types of cholesterol in your blood. And then there's C-reactive protein, and this test measures for the inflammation in the blood vessels that's associated with heart disease. It provides an excellent measure of the cardiovascular disease risk in people with existing heart disease, but it's not really great for people who don't have a diagnosis. Low blood sugar might seem like a really kind of odd topic to talk about while we're busy talking about high blood sugar levels, but it's very important for diabetics to consider, and for others who have reactive hypoglycemia but don't have diabetes. People who are on treatments for diabetes might experience times where their blood sugar drops too far, and this is especially a concern for people who receive insulin therapy or are on certain oral hypoglycemic drugs. The symptoms of having low blood sugar are usually very similar to high blood sugar. They can include things like anxiety, tremors, sweating, hunger, and the feeling of pins and needles. Blood pressure and heart rate also may be higher than normal, and the best way to know if it's too low instead of too high is to take your blood sugar. Any level below 70 milligrams per deciliter is a low blood sugar reading. Today we're going to look largely at preventing and treating type 2 diabetes because it is by far the most common type that there is. And it is commonly seen as a lifestyle disease. It is not autoimmune based, and that means that we can make lifestyle shifts and changes that directly impact the outcome of the disease process that you're experiencing. Until recently, diabetes was labeled as a progressive disease and lifelong, but more recently, studies and discussions have circulated around the idea that it is actually reversible, perhaps not cured, but completely managed with diet to prevent the need for using diabetic medications. There are some studies that suggest that diabetes is likely to be a genetic issue, citing that if someone has a first-degree relative with diabetes, a parent, a sibling, or a child, the lifetime risk for that person to develop type 2 diabetes is somewhere between 5 and 10 times higher than those who don't. However, let's also bear in mind that people with a first-degree connection are often living in a similar environment. They're sharing the same food, they're exposed to the same environmental toxins, and they are living a similar lifestyle. We definitely know that lifestyle is a massive indicator in the likelihood of developing type 2 diabetes, so let's talk about that for a moment. There is a very strong link between obesity and the development of type 2 diabetes. Likewise, there is a strong inverse correlation between physical activity and diabetes too. In other words, most people who develop type 2 diabetes have lower than average physical activity and are overweight or obese. Why is this? Well, it's because obesity makes the cells of the body resistant to the effects of insulin. It also makes the cells of the pancreas less able to detect the presence of glucose in the blood, which means in turn that the pancreas doesn't secrete enough insulin. It is also believed that the fat tissue may release hormones that adversely affect the way the body processes glucose and fat. Fat tissue also releases various molecules that attract inflammatory cells, which then increases your body's inflammation and it also may contribute to insulin sensitivity. Physical activity not only reduces the risk of diabetes, but it also improves health-related quality of life, physical functioning, mental health scores, feelings of vitality, and psychological well-being. Muscles that are used routinely make much better use of circulating insulin and are therefore able to better absorb glucose. Fortunately, even the very most obese patients who manage to lose weight are able to restore the way their muscle cells respond to insulin. Weight loss can dramatically change the amount of medications and/or insulin required to treat a disease process. Exercising after eating can reduce the need for diabetes medications. It would also appear from lengthy studies of the Amish that exercise and hard physical work is preventative. Even if someone already has prediabetes, they're less likely to develop full-blown diabetes. Let's take a few moments right now and talk about some of the macronutrients that we get in our diets. So the first one is fats. Which fats are most likely to be associated with type 2 diabetes? Mostly saturated fats from animal sources and trans fatty acids, which are mostly found in hydrogenated oils. And when this is combined with not eating enough monosaturated and omega-3 fatty acids, it gets really, really ugly. Ideally, in a healthy individual, omega-3 fatty acids should be consumed in a 1-to-1 ratio with omega-6 fatty acids. So where can you find those good fats? Those omega-3 fatty acids are found in fish oil and chia seeds, walnuts, fish roe, which is eggs of fish, fatty fish, seafood, soybeans, and spinach. Omega-6 fatty acids are largely found in palm, soybean, rapeseed, and sunflower oils, as well as corn chips, potato chips, fried foods, and on the healthier side, poultry, eggs, nuts, and cereals. The good fats also include things like olive oil, nuts, and avocados. Nuts are great because they contain fiber and magnesium and they have a low glycemic index. If you're trying to lose weight, then you should not eat more than 1/4 cup of nuts every single day. Dietary fat determines your cell's membrane's composition. So eating too many saturated fats from unclean animal sources and trans fats leads to reduced membrane fluidity, which in turn decreases the binding of insulin to receptors on cellular membranes, decreases insulin action, or both. Trans fatty acids, which are found in margarine, shortening, and other foods that are made with partially hydrogenated vegetable oils, are really bad because they interfere with your body's ability to use essential fatty acids. One study suggested that changing that dietary mistake alone could reduce your risk of type 2 diabetes by 40%. I've spent a lot of time discussing fiber in my lectures before. What is important is that you get 25 to 35 grams of fiber per day, largely from vegetable sources, which means 8 to 12 grams of fiber per major meal. And it's important to stay hydrated too, because that helps keep all that fiber moving through your digestive tract. Now, there are two different types of fiber, soluble and insoluble, and the most beneficial for regulating blood sugar is soluble. Some high sources of soluble fiber include passion fruit, pear, apricots and peaches, avocados, Brussels sprouts, asparagus, turnips, and broccoli. Grain products are things like oats and bran. Other foods include black beans, lima beans, soy nuts, navy beans, pinto beans, kidney beans, tofu, and chickpeas. Fiber slows down the digestion and absorption of carbohydrates, which prevents a rapid rise in blood sugar. They also increase the sensitivity of your tissues to insulin, and they improve the uptake of glucose by the liver, muscles, and other tissues, which prevents sustained elevated blood sugar. In a trial of just 30 men with mildly elevated blood sugar and abdominal fat, the addition of 7.5 grams of dietary fiber each day for 12 weeks lowered their body weight, their body mass index, and their fasting blood sugar. In a trial of 44 participants with type 2 diabetes, they were given an extra 10 grams of fiber per day, and they reduced their waist circumference, their A1C, their urinary protein excretion, and the fatty acid levels that were in their blood. Compared to carbohydrates, proteins keep blood sugar levels pretty steady. When they're consumed on their own, they don't generate a rise in blood sugar. According to a study in 2003 in American Society for Clinical Nutrition, individuals with type 2 diabetes who maintained a 30 to 40 to 30 intake ratio of protein to carbohydrates to fat showed a 40% lower blood sugar response than those who maintained a 15 to 55 to 30 ratio. What does all that mean? Well, it just tells us that protein might be a neutral food for blood sugar levels that can replace some of the carbohydrates to yield better overall blood sugar levels. This is why diabetics are frequently recommended to take anything sweet, like a piece of fruit, with some protein, hence a snack of nuts and a little bit of fruit at the end of it. So that brings us to the topic of carbohydrates, and boy is it a loaded topic. So what I want to do today is introduce two different ways of approaching this and then let you decide what you want to do with the information. I'm not advising that you try either one of these. I'm simply introducing an idea to you. It's become increasingly evident during my studies for this class that everyone is an individual, and how they go about changing their lifestyle has to work for them. If it's not working, then maybe it's time to try something new. We know for sure that a diet that is high in refined carbohydrates contributes to type 2 diabetes. The most prominent school of thought believes that measuring the glycemic index and glycemic load will and then eating within those parameters is enough to help control diabetes. Studies have shown us that increased risk for diabetes and heart disease starts on average with a glycemic load of 45, which is why the recommendations that you see suggest keeping meals under that amount. The second school of thought, which is a little bit more recent to the scene, suggests that since carbohydrates raise blood sugar very, very quickly, protein does that less and fats do it very little. Eating a low but not zero carbohydrate, high fat diet is a way to tackle diabetes. Now this has to be done with an awful lot of caution, especially if you are on insulin and blood sugar lowering medications, because your blood sugar can go too low and cause serious problems. The fats are only your healthy fats, things like coconut oil, avocado, olive oil, etc. There is a physician, her name is Dr. Sarah Hallberg, and she is having great success helping her patients through that process. One of my friends has been trying that for a long time, and she is not on any blood sugar lowering medications, she reported clearer thinking, less pain, and much better blood sugar readings. Whichever route you choose to go, it's important to constantly monitor your blood sugar, and carb counting will be a pretty permanent part of your new lifestyle until you learn what you can and cannot eat. I just mentioned using the glycemic index and the glycemic load to keep track of what you're eating in order to prevent raising your blood sugar. The glycemic index is the measure by which scientists define how food sugars impact your blood sugar. So if a food raises your sugar very quickly and then your sugars drop off again very quickly, it is said to have a high glycemic index. But if foods raise your blood sugar very gently, then they are said to have a low glycemic index. Low glycemic index diets are said to help people manage and lose weight, increase their body sensitivity to insulin, improve diabetes management, reduce the risk of heart disease, improve their blood cholesterol levels, reduce hunger and keep them fuller for longer, prolong physical endurance, and help refuel carbohydrate stores after exercise. Glycemic load is a relatively new thing. It's newer on the scene, and it takes the glycemic index into account, but then it provides more accurate information about how it impacts the stress on your insulin. It gives us more of a sensitive marker that gives us a stronger predictor for diabetes than the glycemic index alone. Doctors Murray and Pizzorno state, obviously, the poorer the control, the more the carbohydrate intake must be restricted. Initially, some people with diabetes, especially those who have poorly controlled blood glucose levels, may need to avoid meals with a total glycemic load of more than 20 and space those meals at least 3 hours apart. The only thing that I would add to this chart that's in front of you here is that these numbers are, in my personal experience, somewhat unique to the individual, and I see them more as guidelines. For instance, a banana is only 48 on the glycemic index, which makes it an ideal food to consume, but it causes me no end of issues with my reactive hypoglycemia. I would eat it, my blood sugar would rise, my insulin production would go into overdrive, it would push my blood sugar down too low, and within 10 minutes of eating a banana, my head would be swimming, my ears would be ringing, and I'd be really, really dizzy. So as I say with all of my presentations, you need to pay attention to how foods make you feel. If you don't feel good, then it's probably not a good food that works well for you. Just for fun, I want to tell you about a study that was done at Newcastle University in the UK. Under the close supervision of a medical team, 11 people who had developed diabetes later in life were put on an extreme diet of just 600 calories a day, consisting of liquid diet drinks, plus 200 calories of non-starchy vegetables per day. They were matched to a control group of people without diabetes and then monitored over 8 weeks. Insulin production from their pancreas and fat content in their liver and pancreas were also studied. After just 1 week, the Newcastle University team found that their pre-breakfast blood sugar levels had returned to normal. 3 months later, 7 of the 11 remained free of diabetes. The theory behind the study was that reducing their calories that severely would remove the fat buildup in their liver and pancreas. The fat buildup prevents the organs from functioning properly and impairs the pancreas from making insulin. The experiment appears to have worked, and others seeking similar results are working with physicians here in the US to achieve the same goals with supervised programs. In the same way that there are nutrients that help to prevent diabetes, lack of certain nutrients and organic pollutants can also increase the risk for a diabetes diagnosis. Diabetes is exacerbated by not having enough antioxidants, and those are those beautiful colors that you find inside your fruits and vegetables, and also by not having enough vitamin C or vitamin E. It's made exponentially worse when those antioxidants are low if you consume high levels of damaged oils, and those oils get damaged when they are heated incorrectly or when they smoke during the cooking process. There are anti-nutrients, things that rob your body of the things you need to heal and prevent disease. These chemical compounds have been linked to the development of type 2 diabetes. They include things like BPA, which is found in plastics and the linings of your tin cans. PCDDs, which are formed when burning fossil fuels and in the manufacture of pesticides and wood preservatives, chlorine bleaching when making paper and in low levels in tobacco smoke, and then also HCBs, which are used as a fungicide. Some studies have shown that exposure to these toxins are a greater risk factor than obesity, and people with the highest levels of pesticides have a 5 times greater risk for metabolic syndrome. Eating organic foods and using natural cleaning agents in your home, avoiding pesticides and canned and prepackaged foods are all good ways for you to lower your risk of developing type 2 diabetes. As we wrap up today, let's take a look at the vitamins and supplements that are necessary for helping to maintain healthy blood sugar. Vitamin A is often low in people with diabetes. Vitamin B complex plays a variety of roles. For example, vitamin B1 supports glucose metabolism. B6 helps with diabetic neuropathy when combined with B12 and folic acid. B7 helps with the metabolism of glucose, and B12 supports healthy nerve tissue. B12 is often low naturally in seniors, and it can be lowered further by traditional diabetes medications. Low vitamin C makes it really difficult to control diabetes with medications. It contributes to poor glycemic control, and enough of it is going to normalize blood glucose. If you just supplement with it, it can improve your blood glucose. Supplementing with vitamin C and E slows the progression of diabetes-related kidney disease, and vitamin C also helps to prevent gum disease in diabetic patients. Vitamin D has also been found to regulate blood glucose levels. Proper functioning of vitamin D and calcium is necessary for the pancreas to secrete insulin. Those with low vitamin D have a 43% higher risk of developing type 2. Supplementation of large doses of vitamin D under a physician's supervision improved fasting plasma glucose and insulin levels and reduced blood pressure. Vitamin E helps to improve the function of insulin-secreting cells in the pancreas, increase insulin levels in the blood, and might also decrease insulin resistance. Vitamin D and E are both fat-soluble, so they can be stored in the fatty tissues, and you should probably periodically check those levels to make sure that they're within the normal ranges with a blood test if you are supplementing with them. Chromium lowers blood glucose tolerance by assisting with the uptake of glucose into the cells. Vanadium lowers blood glucose levels in diabetic rats and acts like insulin to help get glucose into the cells. It can decrease A1C and increase insulin sensitivity. Selenium mimics the effect of insulin and reduces blood glucose levels, but if it's taken in excess, it can exacerbate type 2. A good multivitamin or mineral is going to help you cover all these bases, and I love to recommend Pure Nutrient 950 with NAC because NAC is another nutrient that is a powerful antioxidant that helps prevent the risk of thrombosis, retinopathy, and protect the heart, lungs, liver, and kidneys. Pure Nutrient 950 contains the above listed ingredients that we've just talked about today in safe levels. So we just got done talking about some vitamins that help with diabetes, but let's take a moment now to talk about some minerals and some other nutrients that can help you as well. The first one is CoQ10. That helps to create energy. It's a powerful antioxidant that can improve A1C levels, decrease blood pressure, improve blood vessel function, improve glycemic control, total cholesterol, and LDL, which is your bad cholesterol. The recommendations are around 200 milligrams per day. Omega-3 fatty acids from fish oil protect against heart disease and diabetes, lower lipids, and blood pressure. Now, we talked about foods that contain those earlier, but you can also supplement with 1,000 milligrams combined total of EPA and DHA per day. It's important to select a pharmaceutical grade fish oil like Nordic Naturals. Nordic Naturals actually makes a CoQ10 fish oil that contains 1,000 milligrams of omega-3s and 100 milligrams of CoQ10. Magnesium can improve insulin response and action, glucose tolerance, and the fluidity of the red blood cell membrane in patients with diabetes. Diabetics supplement with 300 to 500 milligrams daily, and Pure Nutrient 950 contains 200 milligrams. And zinc is involved in virtually all aspects of insulin metabolism: synthesis, secretion, and utilization. Diabetics typically excrete too much zinc in their urine, and the elderly typically have marginally low levels of it too. You can supplement with up to 30 milligrams per day, and Pure Nutrient 950 contains 25 milligrams. Manganese is good for diabetics too. It's been shown that diabetics have 1/2 of the manganese of a normal individual. A good daily dose for a diabetic is 3 to 5 milligrams per day. Manganese helps with enzymatic functions involved in blood glucose control, energy metabolism, and thyroid hormone function. Pure Nutrient 950 contains 5 milligrams. Some supplements work really well to lower blood sugar naturally, and these need to be taken with extreme caution, especially if you are already taking blood sugar lowering drugs. Fiber supplements have repeatedly been shown to help enhance blood glucose control, decrease insulin levels, and reduce the number of calories absorbed by the body. The best ones are rich in soluble fibers such as glucomannan from the konjac root, psyllium, guar gum, defatted fenugreek seed powder, seaweed fiber, and pectin. Taken with water before meals, the fiber sources bind to the water in the stomach and the small intestine to form this gelatinous, viscous mass that not only slows down the absorption of glucose, but also induces a sense of fullness and reduces the absorption of calories. White mulberry leaf has been shown in animal studies to reduce A1C levels and decrease blood sugar levels, where the fruit can reduce blood sugar levels to nearly the same degree as metformin. It can also decrease total cholesterol, LDL, and triglycerides, and is a powerful antioxidant. Recommended dosing is 1,000 milligrams 3 times per day for diabetics whose A1C is over 7%. Alpha-lipoic acid is a vitamin-like substance that's often described as nature's perfect antioxidant. It's an approved drug in Germany for the treatment of diabetic neuropathy, and it's also been shown to lead to an improvement in blood glucose metabolism, improve insulin sensitivity, improve blood flow to the peripheral nerves, and actually stimulate the regeneration of nerve fibers. Studies have shown that 600 milligrams of ALA per day can imitate insulin-lowering blood glucose after eating. So lastly, we're going to talk about some supplements that help to improve insulin sensitivity. And I just want to give you a warning that no person under any circumstance should suddenly stop taking their medication for diabetes, especially insulin, unless they are under the direct medical supervision of their clinician. But let's talk about these for just a moment. The first one is Gymnema sylvestre, and it is effective in treating type 1 and type 2 diabetes. It enhances glucose control, reduces insulin requirements, reduces fasting blood sugar and blood glucose levels, and it enhances the action of insulin. It also decreases sugar cravings and helps patients to follow a lower carbohydrate diet. Supplementation can range from 200 milligrams twice per day to 2,400 milligrams per day, and the recommended dosing is 200 milligrams twice per day for diabetics whose A1C is over 7%. Bitter melon contains active components that lower blood glucose and appears to have far less side effects than insulin. Drinking 2 fluid ounces of the juice daily when A1C levels are above 7% has been shown to have really good results in clinical trials. It can be found at Asian grocery stores, but it is very bitter, and it can only be taken by holding your nose and downing it like a shot. American or Chinese ginseng taken before each meal can reduce blood glucose significantly in type 2 diabetics. Not only that, but it can elevate mood, improve both physical and mental performance, reduce fasting blood glucose and body weight. Just 200 milligrams improved A1C levels and physical activity. Defatted fenugreek reduced fasting blood glucose and improved glucose tolerance in tests. It also showed significant reductions in LDL and VLDL cholesterol and triglyceride values. Trials used 1 gram per day of the seed for 2 months and reduced the participants' fasting blood sugars from 148.3 to 119.9. That's pretty significant. Garlic and onions are have both been shown to have significant blood glucose lowering action. Garlic is generally the more potent of the two of them, but onions can be done in greater doses. Ceylon cinnamon can lower blood glucose levels and increase insulin levels in the blood and increase the amount of glucose stored in the liver as glycogen. It may also mimic the effect of insulin. The average reduction in fasting blood glucose was 25 milligrams per deciliter, and doses in the trials range from 120 milligrams to 6 grams per day. Oral aloe vera has also been shown to reduce fasting blood glucose levels and in some trials lowered A1C by over 20%. Lastly, inositol can improve glycemic control, and it's effective in lowering both fasting blood sugar and A1C levels. Well, we have covered an awful lot of territory today, and I am so proud of you for sticking in there with me and hanging on till the end. You can see from today's lesson that exercise, diet, and supplementation are all important factors in the control and management of type 2 diabetes. To reduce the risk of developing the complications of diabetes, it's important to control against elevations in your blood sugar by monitoring it carefully. Modifying your diet and treatment plans are also foundational to successfully treating diabetes. It'll also require some supplements because a diabetic's nutritional needs go above and beyond the needs of a healthy individual. If you need help working through all this information on a more individual basis like Steve did, please make an appointment to see me and I'm going to help you create a plan that works just for you.